Hey, this is Corey from CFS Navigator, and I wanted to talk to you about strategies for getting diagnosed. So, the first thing you do is you rule out everything else, and that process involves checking your iron levels, checking your thyroid, checking for other neurological conditions like MS, Guillain-Barré, um, things things like that. Though you can have MS and ME, there is actually, according to one study of MS patients, 15% of them have ME, so you can have both. Also look for mold exposure, which also can overlap with ME. Look at your Epstein-Barr, whether there's active Epstein-Barr, again, can overlap with ME. Lyme, same thing. But it's important to look at all of those and that be part of your treatment plan. There are comorbidities like POTS that you should check out. Again, very common to have ME and POTS, especially if you have severe ME. But it's important to look at all those things as part of getting diagnosed. So if all your tests are coming back normal, and you have the symptoms of ME, that means you are very likely to have ME. For look at the symptoms, check the symptoms section of cfs-me-navigator.com. There's a lot of information there, links to the CDC sites, but also a lot comprehensive list of symptoms. So if all those things, you've checked out other things, nothing's coming back, and you have those symptoms, you definitely want to print out a copy of the International Consensus Criteria, which I will link here. It is the gold standard in testing for ME, and highlight everything that you're experiencing. It's really important to do that, because if you go into your doctor with a long list of symptoms and complaints, and most doctors are not familiar with ME, they don't understand it, you're likely to get patted on the head and told to lose weight or, to go exercise or get some sunlight or something. And unfortunately, getting treated like that is very, very, very common when you're trying to get diagnosed with ME. If you come in with a list of this is what the International Consensus Criteria says is ME/CFS, and these are the symptoms I have highlighted on that list, they take you more seriously. As to test, there is one test that shows elevated levels with ME/CFS that I'm aware of. It's a C4A inflammation test. It is very rare and hard to get. It's different than the other inflammation tests, which are likely to come back negative. But it also shows elevated levels for toxic mold exposure. So it's not really super helpful. The tests that are in trials for ME aren't ready yet. They have done tests in the lab, but they're not ready yet for general use. So you have ready for your doctor the International Consensus Criteria list with everything highlighted. Your doctor may not know anything about ME/CFS at all. You might want to go to the doctor's section of CFS-me-navigator, and there are some doctor resource links there. You might want to send those to your doctor first and send them the CDC website for ME/CFS so that they're prepared, because it's likely they've never learned about it. Or if they did learn about it, they learned the old flawed model, which was that it was psychosomatic and that exercise was the way to solve it, and cognitive behavioral therapy to convince the person that they're not sick. So if you hear from your doctor the words cognitive behavioral therapy paired with exercise or graded exercise therapy, you need to re-educate your doctor or get a new one if they persist with that. Cognitive behavioral therapy is potentially helpful to deal with having the condition. It is not a cure for the condition. So if they're presenting it as a cure along with exercise, that means that they're using the outmoded ideas of what ME/CFS is. So yeah, those are the biggest steps. For more information on convincing your doctor about ME/CFS, look at my Talking to Doctors series, and look at the doctor section of ME of the website I mentioned. It is uphill work finding a doctor. I will tell you that now. You are likely to be dismissed. The best doctor to go to is another big question. Really, it's the doctor that is most informed and most likely to help you. Like, if they're your general practitioner and they believe you and trust you and are willing to work with you and willing to learn about ME/CFS, they might be your best bet. After that, I would say infectious disease specialists are the best as a category. I have personally had the worst luck with neurologists, and across the board, everyone I've heard from has had the worst luck with neurologists. There's like one guy who's an exception, but really neurologists are often very problematic. I would stick with a doctor who looks at the material you give them, or is familiar with ME as a medical condition, not a psychological one, and do your best to educate whatever doctor you're working with. One thing I forgot to say was that the symptoms have to persist for 6 months or more for it to be considered ME/CFS. And part of this is that a lot of people actually recover in those first 6 months. So that is a hopeful thing. If you are very early in this process, if you're in the first 2 years, you have a chance of going into remission or recovery. And after the first 2 years, the chances get very, very small of full remission. But if you rest and pace, that is your best chance. So if you are very early on, please rest and pace. But if you're in the first 6 months, it won't be officially ME until then. Also, another thing I didn't say is that it often happens after a viral infection. And sometimes it's a virus that it's a mild virus, or even a asymptomatic virus. So you may not even know you got sick. And so that may be one of the cases. If you got ME out of nowhere, maybe you had an asymptomatic virus. Stress is a component. If you had a traumatic event or very stressful period, stress is known to take down the immune system. One of the theories about ME/CFS is that you're putting your immune system into fight flight, and that can definitely happen with a virus. And it seems like it's, from the research I've seen, that having high stress or trauma, an accident, a surgery, things like that can also send your immune system into this fight flight. So that is one of the theories of ME out there, and it definitely makes sense because a lot of people do get ME after not just a virus, but after stress or an accident or surgery. So just to know that those are possible triggers. Obviously, COVID is a virus, and a lot of people are getting ME/CFS after COVID, and goes from long COVID to ME after 6 months. So I wish you luck. Definitely look at my Talking to Doctors series and look at the website. And good luck.